Welcome to Mastering Section B, Hearing, Speech, and Vision on the MDS. In this video, we'll help you identify the various components of Section B, understand the coding instructions, accurately assess hearing, speech, vision, and health literacy, prevent common coding errors and misconceptions, and recognize the impact of Section B on care planning and how you can support the resident and facility. The intent of items in this section is to document whether the resident is comatose, the resident's ability to hear with or without assistive hearing devices, understand and communicate with others, and the resident's ability to see objects nearby in their environment. It also provides a space to better understand the resident's health literacy and their capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Items included in this section are coma or persistent vegetative state, hearing and the use of hearing aids, speech clarity along with the ability to be understood and understand others, vision and the use of corrective lenses, and health literacy. Under Item B0100 comatose, we're determining if the medical record indicates that a physician or licensed designee has documented a diagnosis of coma or persistent vegetative state that is applicable during the 7-day look-back period. Based on our findings from the preceding question, we can now appropriately answer the next set of questions, B0200, hearing, through B0800, understanding. The objective behind these items are to ultimately identify how well a resident can hear, speak, and understand during daily interactions. Similar to our hearing and speaking assessments, evaluating the resident's ability to see and their use of corrective lenses will be determined in Item Set B1000, Vision, and B1200 corrective lenses. Following the documentation of those items, we'll have the opportunity to better understand the resident's health literacy in Item B1300. Similar to language barriers, low health literacy interferes with communication between provider and resident. Health literacy can also affect a resident's ability to understand and follow treatment plans, including medication management. When coding Section B, it is good to familiarize yourself with the steps of assessment used to answer each question. Most of these will include interviewing the resident, asking family or staff across shifts, evaluating by direct observation, and by reviewing the resident's record or medical history. An exclusion to those steps will be when we're determining the resident's health literacy. This item exclusively relies on the resident's response, and no other sources should be used to identify the response. Here we will ask the resident, how often do you need to have someone help you when you read instructions, pamphlets, or other written material from your doctor or pharmacy? And code accordingly. Deficits in these domains can contribute to sensory deprivation, social isolation, mood and behavioral disorders, and are often mistaken for confusion or cognitive impairment. Communication abilities can affect safety, participation in care planning, mood, social engagement, and are vital for accurate assessments. Information obtained in this section can now help guide us as we develop the resident's plan of care. Based on the resident's needs, interventions may include environmental modifications such as quiet spaces, audiology appointments, or maintaining hearing aids. Incorporating alternative communication methods like writing, visual boards, speech devices, or maintaining visual appliances in good working order. Identifying preferred means of communication such as gestures, direct responses, interpreters, or picture boards. And ensuring that important information like safety, medications, or care changes is delivered in a way that will be understood. When completing Section B, avoid common coding errors such as confusing unresponsiveness with coma, assessing vision without glasses or corrective lenses when they are usually worn, not assessing hearing with usual hearing aids in place, or allowing a staff or family answer the health literacy question, as this should be exclusively resident self-report. Section B plays a pivotal role in the resident's care plan, which is why coding accuracy is imperative. Here are a few tips to consider to help improve coding accuracy. Utilize the resident's preferred language. Use interpreters when needed, and do not code comprehension or speech ability lower due to language barriers. Assess with usual devices. Ensure hearing aids, glasses, or other corrective devices are in place and functioning. With the exception of health literacy, utilize multiple sources of information like observation, staff input, resident and family interviews, and medical records. And lastly, document findings clearly by recording what was observed, what aids were used, and who provided information. For more information about coding the MDS or to find more MDS-related content, follow our channel at MDS Made Easy. Brought to you by the Data Nurse, your partners in MDS Precision. Thanks for watching.